Welcome to the 2020 Benefits Enrollment. This presentation will provide you with a review of the unique programs and benefits available to you through the Rollins insurance plans. For the upcoming new plan year, our coverage will remain with these exceptional brand partners. We do not have any changes to the coverage provided by all of our brand partners. The following slides will review the unique features built into our plans. With Blue Cross Blue Shield medical coverage, the option of Blue Distinction Total Care Providers remains, allowing you to have zero-cost office visits for well or sick care. Blue Cross Blue Shield Care-Connected Concierge Assistance will also be available to all members. Your medical coverage will continue to include Surgery Plus, allowing you the option for a no-cost, non-emergent surgery on specific covered procedures. Do you ever find yourself in a situation where you just need to speak to a doctor instead of scheduling an appointment or waiting to see a provider? Teladoc allows you and your covered family members the opportunity to speak with a licensed doctor and get treated for simple ailments and acute conditions. A Teladoc visit only costs $5 and is an eligible HRA expense. Be sure to register in advance at teladoc.com or call 1-800-TELADOC. If you need to see a physician in person, you have several options available. Your primary care physician should help you manage your health and ongoing medical conditions. Convenient care clinics, such as those in CVS stores, are staffed with medical professionals who can diagnose and treat various acute conditions, as well as provide flu shots. Urgent care facilities can also be used for such conditions but will have a higher cost. And emergency room visits are the most expensive and should be used for life-threatening conditions. The iCubicare's Pharmacist Advocate Program is a great prescription drug resource. Call them for a prescription checkup where they can review your current medications, discuss side effects, make sure the drug interactions are appropriate, help you navigate the preferred brand versus non-preferred tier confusion, and help you coordinate with your doctor and the insurance company for things like prior authorization, step therapy, quantity limits. iCubicare's has real pharmacists who are real advocates with real solutions. You may receive phone calls throughout the year from care consultants with Blue Cross Blue Shield, OptumRx, iCubicare's, or Aetna. You should speak to these advisors who will help you manage your medical conditions and answer questions you have about your plans. We will continue offering two medical plans this year, the Preferred PPO Medical Plan and the $4,000, $8,000 PPO Deductible Plan. There are no changes this year to the plan designs. The Preferred PPO offers lower deductibles and coinsurance. The $4,000, $8,000 deductible plan has a higher deductible, higher coinsurance, and higher out-of-pocket expenses than the Preferred PPO plan. The plan has a $4,000 individual and $8,000 family deductible and larger out-of-pocket maximums. Let's take a moment and look at this in-network plan comparison. Please note that this only shows in-network benefits for each plan. The plans look very similar in design, but the cost differences can be significant. You'll see that some services on the $4,000, $8,000 deductible plan are a flat copay, which may cost more than the coinsurance on the Preferred PPO plan. Please pay close attention to the cost of services your family will use most. It is important to remember that the deductibles on both plans do not apply to many visits. Here you see over 30 common services that do not require that you meet the deductible. Instead, you will just pay the coinsurance or copay depending on the plan you select. Once again, under both plans, the deductible only applies to certain services, including those that you see here. This means you will have to pay 100% until you reach the deductible before the plan will pay for any of these claims. Our Rally incentives have increased for the 2020-2021 plan year. Regularly seeing your primary physician is so important, and now you'll be rewarded $60 in Rally money for doing so. The incentive for obtaining your biometrics has also increased and will now be available via a physician's results form to be provided by your doctor. This allows you the opportunity to review your results directly with your primary care provider. More information to come. We love your participation in our on-site events and are happy to reward you for attending a few more. Don't forget about the other ways you can earn coins and prizes with Rally. The Clinical Rewards Program is a great way to earn coins for managing your chronic conditions. Do you track your activity on a regular basis? If so, be sure to participate in the city challenges and private sweepstakes through Rally. Many of our Rollins employees have won gifts and Amazon gift cards. Our Employee Assistance Program, administered through Resources for Living, is free and confidential and is an often forgotten benefit. Resources for Living is available for all active employees, dependents, and household members, regardless of medical plan coverage. 6 counseling sessions per issue are available each plan year. You may call Resources for Living for anything, emotional support and counseling, to lifestyle referrals including legal services, financial planning, or even just a need to find a local resource to watch your dog or mow your lawn. You may continue to seek the services of a counselor without leaving your home or work. Talkspace allows you to have a visit with a therapist remotely via the web or mobile app. You can send text or audio messages and hear from your provider within one workday, and about 1 week of messaging equals 1 session. To establish with Talkspace, begin by calling Resources for Living for authorization. Users must be 18 years of age or older. All visits are confidential. If you have the Blue Cross Blue Shield medical plan, you are also enrolled in Aetna's behavioral health program. The behavioral health program is for longer-term professional counseling and psychiatric treatments beyond the 6 free counseling sessions you may receive through the EAP benefit. We shared with you 2 different medical plans to choose from for the new plan year. They are both customized for the needs of our employees and offer enhanced benefits that may not be seen in other plans. For example, we discussed how the deductible does not apply in many situations. We are able to tailor the plans because the medical plan with ICUBA is a self-funded plan. Having a self-funded plan means that premiums are collected by ICUBA from both the employee and Rollins contributions. ICUBA uses these funds to pay claims as they are processed by Blue Cross Blue Shield, OptumRx, and Aetna Behavioral Health. So in essence, we, the employees, and Rollins are paying for the claims incurred by those in the plan. The carriers receive an administrative fee to assist in processing the claims on ICUBA's behalf. Establishing premiums each year is a balancing act. ICUBA must collect enough premiums in the plan year to pay for projected claims. ICUBA utilizes a consultant to project claims trend and determine the annual premium increases. If the actual claims paid exceed the premiums collected, premiums must be increased even more the following year. If claims are less than premiums collected, the excess is used to offset premium increases the following year. Think of it like balancing your finances at home. The goal is to avoid financial loss. Here you see the new rates for the preferred PPO medical plan. A 3% increase in premiums is what we've projected is needed to cover claims for the new plan year. A 3% increase remains significantly less than the national trend of 9%. Rollins will continue to fund your HRA account each month that you are enrolled in the ICUBA medical plan. This means you can receive between $1,500 and $2,100 in your HRA account each year. This shows the change per pay period in the medical premiums based on the coverage tier you elect. Increases range from about $7 per month to about $20 per month and will be reflected in your first pay in April. Keep in mind that the rates are deducted before income taxes, so you will end up paying a little less than the premium. This shows the change per pay period in the medical premiums based on the coverage tier you elect. Increases range from about $7 per month to about $15 per month and will be reflected in your first pay in April. The premiums for the Employee Plus Children and Employee Plus Family tiers did not increase for the 2020-2021 plan year. Keep in mind that the rates are deducted before income taxes, so you will end up paying a little less than the premium. This shows the current change per pay period in the medical premiums based on the coverage tier you elect. Increases range from about $15 per month to about $41 per month and will be reflected in your first pay in April. Keep in mind that the rates are deducted before income taxes, so you will end up paying a little less than the premium. Oftentimes, there is confusion regarding the health reimbursement accounts and flexible spending accounts. Health reimbursement accounts, known as HRA, is fully funded by Rollins, and these funds are deposited onto an IQUBA MasterCard at the end of each month. This fund is automatic if you are enrolled in an IQUBA medical plan. After 36 months of continuous participation in an IQUBA medical plan, you are considered vested and the funds are yours to keep. These funds may only be used for eligible healthcare expenses incurred by the employee and covered dependents. The funds roll over at the end of each plan year as long as you are on the IQUBA medical plan or vested, and these funds earn interest quarterly. We offer two different flexible spending accounts. The Healthcare Flex Spending Account is funded by the employee with pre-tax contributions, up to a maximum of $2,700 per year. You do not need to be enrolled in an IQUBA medical plan to elect an FSA. The entire FSA election amount is available on 4119. These funds are subject to the use it or lose it rule, so plan wisely on your medical expenses. These funds may only be used for eligible healthcare expenses incurred by the employee and taxable dependents, and these funds may be accessed by using your IQUBA MasterCard. Please note that this benefit does require active enrollment each year. Our second flexible spending account, the Dependent Care Flex Spending Account, is funded by the employee with pre-tax contributions, has a maximum calendar year limit of $5,000 per household. These funds may only be used for the care of dependents under the age of 13 and physically or mentally challenged adults who are unable to care for themselves when employee and spouse are either working or looking for work. These funds are used to pay for eligible dependent daycare expenses, preschool, summer day camp, before or after school programs, and child or adult daycare. This plan also is subject to the use it or lose it rule, so plan wisely. And these funds are available as they are deducted from payroll. Please note this benefit also requires an active enrollment each year. We are still offering the 3 Humana dental plans. The plan design and rates for all 3 plans will remain the same for the 2020-2021 plan year. As a reminder, the DHMO has in-network coverage with a smaller network of dentists, but is the lowest cost option. The Preventative Plus Low Dental option has more dentists to choose from, but only covers preventative services. And finally, the High Dental Plan option also has more dentists to choose from, but it covers preventive, basic, and major services. This makes the High Plan the most expensive plan option. There are no changes to the vision premiums or plan design. iMed will continue to offer a comprehensive vision plan to covered members. During open enrollment, you may have the opportunity to increase your life insurance coverage. If you elect life insurance for yourself over $150,000 and more than $50,000 for a spouse or partner, you will be required to complete an evidence of insurability form. Open enrollment will take place between February 10th and February 21st. Please note, enrollment is only available until 5 p.m. on February 21st. You only need to participate in enrollment if you want to continue or add flexible spending accounts, you want to make changes to your benefits, or you want to add or drop dependents. Even if you don't meet the criteria mentioned, it's suggested that you review your benefits to be sure they're what you want for the new plan year. You should also review your beneficiaries for your life insurance plans. Beneficiaries may be changed any time in the year at IQUBAbenefits.org. During open enrollment, you can make changes to your benefits for the April 1st through March 31st plan year. Once open enrollment is over, you can no longer make changes until the next plan year unless you have a qualifying life event during the year. If you have such an event, you must make changes within 30 days of the life event at the IQUBA website. For open enrollment, go to the IQUBA website and click on Start Your Enrollment, then proceed throughout the enrollment process until you reach your confirmation. Then your enrollment is complete. As a reminder, be sure to review the eligible dependent rules for the plan and drop any who do not meet the criteria. Thank you for viewing this presentation on the open enrollment changes. Additional information can be found at the benefits page of the Rollins website or at IQUBAbenefits.org. Need help with your password? Click on the Forgot Password link or contact B Swift at the number found on the IQUBA website. Thank you, and Fiat Lux.